All right, hello everybody, and welcome to the Healthy Start TA Center's official TA launch webinar. My name is Tess Pritchard, and I'm the project specialist on the TA Center team here at NICHQ. I'm going to begin this webinar by reviewing some housekeeping items to ensure you all get the most out of this webinar before handing it off for your official welcome. You can change this slide. All right, so Scott Burns, CEO of NICHQ here, and Ken Harris, the project director of the Supporting Healthy Start Performance Project, will welcome you to this webinar. We will then hear from the TA Center's evaluation team on findings from the needs assessment. Ken Harris will then run through some existing TA activities and review the TA request submission process. I will then introduce a new collaboration platform that the TA Center will be providing to all the Healthy Start grantees, and we will complete the webinar with a Q&A session. Moving on to some meeting logistics. All right. This session will be recorded and will be posted to the Epic Center for future viewing. All participants are muted upon entry. We ask that you remain muted to limit background noise. We encourage use of the chat box during this webinar to ask questions and post comments. All questions will be captured from the chat box, and we will address as many as we can during the webinar. Following the webinar, we will create a Q&A document that captures all these questions and answers that will be posted to the Epic Center along with the webinar recording. So moving into some audio logistics. If you can hear me right now, you're likely connected correctly, but we'll do a quick review to ensure everyone's on the same page. So you're going to join the meeting by clicking the link in the email that was sent to you upon registering for this webinar. An audio conference box will appear upon joining the webinar. You can click to join by either computer audio or phone call. If you'd like to use computer audio, just click the computer audio button. And if you would like to join by phone, dial the given number, enter the meeting ID and press pound, then enter your given participant ID and press pound. You'll be connected to the webinar audio. Finally, to finish our housekeeping, I'll review use of the chat box. At the bottom of the Zoom screen, you will see a toolbar. Click chat, and it will launch the chat box to the right side of your screen. Type your questions and comments into the chat box and send to everyone. Again, we encourage the use of the chat box for any questions or comments during this webinar. Now I'm going to turn it over to NICHQ CEO Scott Burns and Supporting Healthy Start Performance Project Director Ken Harris for opening remarks.
Okay, thank you, Tess. Just before Scott comes on, just want to say good afternoon to everyone. I am Ken Harris, the Senior Project Director here at NICHQ. Project Director for the Supporting Healthy Start Performance Project. And it's exciting to say good afternoon to my colleagues around the country. There are over almost 150 people on the call today, so we really thank you for joining today's webinar launch of our TA. So we're happy to be with you, and I'm happy to be here with the NICHQ team. And I want to introduce you to Dr. Scott Burns, who is our CEO, and he would have a greeting, and then we'll come back and get started. Scott?
Great, thanks Ken and Tess. Good afternoon, good morning to some out there, to all of you Healthy Start grantees. The last time I had the opportunity to greet many of you was at the National Healthy Start Association's annual meeting in DC last October. And I'm thrilled to have the opportunity to greet you today as our team presents highlights from the needs assessment and officially launches the technical assistance for Healthy Start grantees. And NICHQ is thrilled to serve as the Healthy Start TA Center under this federal cooperative agreement with HRSA. It's the Supporting Healthy Start Performance Project. We're happy to be the prime on this grant and are confident that we have chosen the right partnership in this endeavor with the National Healthy Start Association. NICHQ is thrilled to have the association and Deborah Fraser as its key partner on this cooperative agreement, and we look forward to the association's role in partnering with NICHQ to facilitate some of the TA for Healthy Start grantees through a sub-award to the National Healthy Start Association. Again, we are excited to share today's report with you, to be on this journey with you. I want to add a thank you for your patience and support to the NICHQ team, and welcome again to today's presentation. Ken?
Thanks again, Scott. And so at this time, I would like to introduce our TA Centers team. And again, thank each of them for their work on this project. And you're in for a treat as we review the highlights of this needs assessment. I would like the team to say hello to you so you get an idea of what their voice sounds like as we go through the presentation. You heard from Tess already, but Tess, if you'd like to say hello again.
Hello, I'm the project specialist here at NICHQ on the Supporting Healthy Start Performance Project.
And you heard Olivia's voice earlier. Olivia?
Hi everyone, I'm the project manager here at NICHQ on the Supporting Healthy Start Performance Project. Thank you for joining us today.
Okay, and Becky Russell is also on the call. Becky?
Hi, good afternoon, everyone. Can you hear me okay there?
Yep.
Okay, great.
Also, Emily, who is our senior analyst here.
Hi, I'm Emily O'Donnell. Thank you.
All right. And lastly, we have Jordan Tate Thomas here, who's an analyst.
I'm Jordan St. Thomas, and I'm the head.
All right. Becky, I'll hand it over to you to start us off and take us through the needs assessment report. Thank you.
Great, thanks so much. Go to the next slide. I think I'm Becky Russell. I'm the Senior Director of our Division of Applied Research and Evaluation at NICHQ, and just really excited to be a part of this project and to oversee all of our evaluation efforts. The first big task we had as part of this was to conduct a needs assessment. And so we're going to spend about the next 20 minutes going through some of the findings of that report. That report has been shared with all of you, and we hope that you will take a look at it. We really welcome the feedback from you all as you're looking at it, making sure that it does capture the needs that you feel your programs and your role within those programs need in order to really help inform our capacity building assistance to you all. So just as a quick agenda, I'm going to go over briefly the overall goal of the needs assessment. I'll talk about some of the methods, and then I'll turn it over to Jordan Tate and Emily to discuss with you the results and share some of the cross-cutting themes that we were seeing across our activities, and then we'll wrap it up with Ken at the end to talk about what some of our next steps are. So, as I said, the overall goal of the needs assessment was really to help us identify what those capacity building assistance needs were of the Healthy Start programs in order to help us develop what it will hopefully be a responsive CBA curriculum and a plan. We really want to make sure that we are delivering the technical assistance that you all need in the ways that you need it. And so really starting with looking at what are the needs, trying to identify both the strengths of the programs and identify the gaps where we can really help fill those needs. And then also taking a look at some of the needs assessment findings, taking a look across the programs, and trying to determine how it might be best to deliver that CBA to you all, and thinking about how we might categorize grantees into different cohorts based on what those needs are and based on some of the themes of those needs that we're seeing. We do plan to deliver CBA in the four main areas of the Healthy Start model, including improving women's health, improving family health and wellness, promoting systems change, and then assuring that impact and effectiveness through ongoing Healthy Start workforce development, data collection, QI, performance monitoring, and program evaluation. So our activities really focused on trying to look into all four of those areas and making sure that we are identifying what those needs are. So you go to the next slide. Our activities around the needs assessment focused in three areas. We held calls with MCHB project officers. We did in-person focus groups, and then a survey was sent out to all the project directors. Throughout all of these activities, we really tried to utilize existing standardized questionnaires that were already out there. We did develop standardized surveys and interview guides to make sure that the data collection that we were doing was as robust as it could be. The discussions with those MCHB project officers that I mentioned, as of today, we have been able to speak with 5 of the 15. We are still doing outreach and trying to connect with those project officers. But in talking with them, we really focused those discussions to get their perspective on areas for technical assistance, the methods of delivering that technical assistance that they felt would be the most productive, looking at mentoring needs of the grantees, and then looking at specific subject matter expertise to help us ensure that we were delivering TA in the best possible ways. The second activity that we conducted was some in-person focus groups that we held with key stakeholders at the National Healthy Start Association meeting last year. We were interested in hearing specifically from perspectives of three key audiences, the first being fatherhood coordinators. We held a focus group that had 29 participants with the purpose of trying to understand how those coordinators are connected with other Healthy Start staff, to look at the trainings that they were receiving, the support that was available to them, as well as how those staff recruited and retained male partners. The second group of focus groups were with frontline staff, and we held those to understand intake processes, challenges with making referrals and connection to services, and the frontline staff's experiences with recruitment and retention. And then finally, we felt it was really critical to hear directly from Healthy Start consumers around the needs assessment. So we held a focus group with consumers to discuss their engagement with their local Healthy Start programs, as well as barriers and challenges that they felt they faced in receiving necessary services. So really critical to understanding the context of the rest of our activities, really having that consumer voice and making sure that we were hearing that. And then the final activity that hopefully most of you were familiar with or participated in was the survey that was sent out to all project directors of Healthy Start programs. We're really happy to report that we had a 67% response rate on that, hearing from 67 of the 101 project directors. And I will just say that there will be an opportunity for those project directors who haven't had a chance to fill that out. We know how incredibly busy you are, so we still will have that survey open and would love to hear from you. You'll get some more information about that at the end. So with that, I'll turn it over to Jordan Tate to get us started with going through some of the results. Thanks.
Hi, everyone. I'm Jordan Tate, and I will be taking you through some of the results. So across all of our activities, NHQ heard from about 145 Healthy Start stakeholders. And through the focus groups, PO calls, and the PD survey, we heard common themes emerge among these three groups, and we wanted to highlight pertinent areas. So starting with the focus groups, what we heard across all three focus groups that we held was the importance of engaging community in activities, as well as supporting participants with transportation, housing, and other non-service related needs. For the project officers, what we heard in these calls, and we'll go over this more in detail later, we heard about TA around technical assistance around recruitment and outreach, as well as support for the fatherhood and breastfeeding initiatives. And then during the project director's survey, what we heard was technical assistance in recruiting and engaging fathers, and also support needed for fatherhood coordinators, as well as that grantees struggled with benchmarks 7 and 8, which are related to breastfeeding, and 14 and 15, which are related to father and partner involvement. Next, please. And during the project officer discussion results, we wanted to highlight specific areas for TA, though 10 areas were mentioned. The most notable need for support raised by the project officers was in the area for fatherhood initiatives, specifically in the areas of outreach and recruitment strategies for fathers, as well as time and space for fatherhood coordinators to share challenges and successes that they may come across. Also, what we heard was that a shared definition for fatherhood was also seen as a pertinent need. On the topic of breastfeeding, support for breastfeeding initiatives were mentioned, as well as dedicated time for international board certified lactation consultants to have the opportunity to share successes and challenges as well. Project officers also mentioned challenges related to recruitment and outreach for participants, especially for rural grantees, and also a need for mentoring opportunities and help with the screening tools. Next, please. So for the focus group results, as Becky mentioned earlier, we conducted focus group with three key groups to help these start consumers, frontline staff, and father coordinators. Across the three groups, we wanted to highlight key themes brought up across groups. Across all the focus groups, we heard key themes that facilitated Healthy Start program successes. These included recruitment of fathers through case managers in two-parent households, and recruitment of mothers through referrals from healthcare providers, WIC, and other means. We also heard in all three groups about the importance of engaging communities in activities and CANs, as well as in referring participants to social services. Some barriers mentioned were a lack of a shared definition of father, as well as a lack of guidelines around the Fatherhood Initiative, which we also heard during the PO calls, as I mentioned earlier. Another barrier mentioned was the large casehold of male partners/fathers. And in regards to recruitment, we heard that engaging homeless and undocumented moms seemed to be a barrier, as well as participant retention in the program. We also heard about competing priorities of participants, including transportation, housing, and food instability. Another area was stigma, especially regarding topics such as breastfeeding. The last barrier we wanted to highlight during these focus groups were funding or lack thereof, specifically for providing incentives to both male and female participants. And one group in particular we wanted to highlight were the focus group results for the consumers and points raised during this group. One thing repeatedly mentioned by consumers was that incentives such as stipends, childcare, and food really increased engagement. Consumers mentioned seeing this as a form of being valued for their time, and this really motivated them to attend meetings outside of Healthy Start services. Consumers also mentioned competing priorities such as housing and transportation that really challenged their participation in Healthy Start. Participants in this group mentioned preferring one-on-one meetings with Healthy Start staff as to develop meaningful relations and instilling trust. It also allowed these participants to be more receptive of hearing about things outside of Healthy Start services. We also learned that transportation encouraged participation, and one participant mentioned a Healthy Start ban that community members outside of Healthy Start recognized that allowed them to feel safer. Lastly, the importance of trusting relationships between consumers and staff, which takes us back to those one-on-one meetings that I touched upon earlier. And we thought it was important to show a quote from one of our frontline staff participants, which really highlights what we learned across all of the focus groups. And I'll just read it here. At the core of this are the issues of resources, poverty, and need. Incentives can be married with the important education and support that Healthy Starts gives them. But if women are hungry, they don't want to hear about your birthing class. No matter what you do, as we talk about trouble with retention, we have to face that. People want stuff that they need. They're not going to come to classes without their real/more immediate needs being met. It's hard for them to concentrate on other things if they can't meet their needs. And we thought this really highlights what we learned across all of the focus groups, as well as what we came across in our project director survey, which Emily will now go into.
Thanks, GT. Yeah, we're really delighted to share with you the project director survey results, of which many of you participated, and we're truly grateful for your time and your comments that you provided, because it really does help us consider your TA needs and provide them in the ways that are most useful to you. The project director survey, as many of you know, included roughly 60 questions that covered various topics, including staffing at Healthy Start sites, benchmarks, technical assistant needs, and various programmatic needs. And we also collected baseline data on quality improvement, data collection, partnerships, and sustainability. So I think you've all seen the needs assessment report, and so here I'll just provide very high level information about the project director survey results. To start with staffing, we learned in the survey that most grantees employ roughly 11 to 15 staff, including community health workers, social workers, nurses, and fatherhood coordinators. We learned that about 2/3 of Healthy Start grantees have at least one certified lactation consultant on its staff, although we did hear that about 1/5 had one or more IBCLC. We also heard that some Healthy Start grantees included other staff, such as mental health counselors, substance abuse counselors, certified mental and behavioral health peer specialists, and recovery support specialists and coaches as well. There were several questions on the project director survey that were dedicated toward understanding how grantees are doing with benchmarks. We heard several successes, including that grantees are generally doing really well in regards to benchmarks related to health insurance enrollment, linking participants with usual medical care, and CAN implementation. So that was really wonderful to hear. We also included a larger table in the actual needs assessment deliverable that reviews all of the benchmarks and attempted to highlight in red the areas where less than 50% of project directors responded that their program had successfully met a benchmark, or where more than 50% reported that they struggled to meet a benchmark. And we noted that challenges with postpartum visits, breastfeeding, and father partner involvement were revealed in these benchmark data. We spent a lot of time in the project director survey trying to understand programmatic needs, including technical assistance needs, as well as any needs related to meet the Healthy Start targets of 300 pregnant women, 300 infants and children, and 100 fathers. We wanted to highlight several areas of programmatic strengths. We were impressed to learn that 98% of project directors reported that their programs connected participants with community resources, that nearly all grantees have a CAN in place, nearly all grantees screen for social needs, roughly 80% have HRSA supplemental funding to hire clinical service providers, and roughly the same proportion have already hired a fatherhood coordinator. So well done, that is great progress. We are also learning about TA needs both in the immediate term, in the next 3 to 6 months, as well as the next 2 years. And here we just highlight the most urgent TA needs that we heard, which include fatherhood and male partner recruitment and engagement, female participant recruitment and engagement, CAN development, and also data reporting. So another thing that we did in the project director survey analysis was to examine certain subgroups and try to understand whether certain groups might need particular assistance, whereas other groups need a different type of technical assistance. We noted that continuing grantees reported more success with benchmarks in general. We also noted that new to this particular funding cycle, grantees may need supports related to engaging female participants in communities. And in addition to looking at the tenure of grantees, we also examined survey data by grantee location, so whether or not a site was categorized as urban or rural or a tribal or border community. And we noted that there could be some differences in how benchmarks were achieved according to grantee location, and there may also be potential for mentorship opportunities for these different groups. So we wanted to reflect on some of the cross-cutting themes that we noted across all 3 needs assessment activities. We've discussed the focus groups, the project officer calls that we held, as well as the project director survey results. And we wanted just to review some of these themes briefly, including most notably that one size does not fit all. We completely appreciate and recognize the unique characteristics of each and every Healthy Start site, and that you know, although we can try to categorize sites into different cohorts and try to group sites, we do appreciate that one size does not fit all, and that we'll need to tailor the technical assistance planning going forward depending on what you and your particular program need. We also heard about fatherhood program assistance across all activities, from project officers to fatherhood coordinators themselves to even consumers noting that they wish they'd seen more dads at the different Healthy Start meetings that they attended, and certainly across the project director survey as well. We heard in multiple places the need for efforts to increase participant retention. We also heard that there's a need to address various social determinants of health, including housing and transportation, and that being imperative to retaining and recruiting women. We heard that although most Healthy Start performance projects already do have a CAN in place, that there's ongoing need to support the community action networks. And lastly, breastfeeding and data collection and reporting came across in several different activities. And just a quick note about the CAN specifically, because we really feel like this is such an integral aspect to Healthy Start programs. Of course, we did say that 95% of grantees reported already having a CAN in place. And yet we heard from multiple activities that support for CAN development would be very valuable as NICHQ considers its TA planning going forward, particularly in the next 3 to 6 months, and perhaps for grantees in certain communities, such as border communities, and for new and never funded grantees. We also heard from frontline staff that more time and resources to devote to their CANs would be appreciated. Great, and I will turn it over to Ken to talk about the next steps with regards to our TA.
All right, well, thank you, Emily. So as we think about next steps, what happens now that this needs assessment has been completed? So we certainly want to encourage you all that have not had time to review it, to make sure that you go through it and just look for other data points there, but also to say that there was lots and lots of data collected, and so we'll be able to do deeper dives into many of these topics. But as far as next step, today was important to use this report to share with you as a launch for our TA, because it's really critical as we begin to continue to design the TA and CBA. The needs assessment has been made available to the Faculty Planning Committee, which is the group of organizations and individuals that will be helping us design the CBA. Also, you'll see later on, there are subject matter experts that are engaged with us that will be responding to many of your TA needs around specific topics. And so again, utilization of this report to inform that would be important as a next step. We also will be developing webinars based on, again, topics that have emerged through this report. We also looking forward to providing some on-site TA offering at the upcoming grantee meeting in the spring. And then with regards to data collection, using the data that we have to continue, as I said, to build the capacity building assistance. So those are some next steps related to this document. We also provided or created highlighted documents as well, which we'll be able to use with subgroups. For example, the focus group with the fatherhood coordinators, we'll be able to use that with our Father Talk Tuesday, those coordinators, to kind of take a deeper dive at some of the learnings from those focus groups. And so again, making the data available to specific groups, whether it be around breastfeeding or other groups, so that they can go deeper dive into this data. So those are our next steps with regards to this report, and we encourage you to use it as a tool as well. Also, we want to highlight again, as you've heard from the team, that the project director survey is still open. We do realize that when we were conducting the survey, we had a lot of things going on last fall, and we recognize that project directors are quite busy. And so again, thank you to those that were able to complete the survey. And I know that I spoke with many of you who were unable to complete it, but you said you really wanted to. And so we've decided just to keep that survey open, and we'll continue to take that data. So thank you to all that responded. And for those that have not, an email will be sent to you with the link to the project director survey for you to complete. And we do hope that folks are still encouraged to complete that survey. So thank you again. So at this time, as you've heard the highlights of the needs assessment report, are there any questions or thoughts that you have just with this high level report over the highlights? Or if you've had a chance to read it, any other questions come to mind related to the needs assessment report? We'll take those now.
Yes, so you can enter any questions you have in the chat box. We already have 2. Just quickly, where can the needs assessment summary be found? So we sent that out on Friday, but it's also posted to the EPIC website, and we can send out another reminder email with that link to that document. Another question that we received from Mary Powell Thomas is, in the previous grant cycle, mentoring was a level 3 responsibility and those grantees were compensated for it. Will there be compensation for mentoring in this cycle?
So since we don't have that structure anymore, that quick answer would be no. What we've done is we've contracted with the association, as you heard earlier, as our partner, and they will be, Deborah will be working and creating the mentoring program. So we'll do that together with the association. But since we don't have those levels, again, level 3, 2, and 1, we're not going to move with that framework. So there'll be no compensation. We're just looking for those sites that have expertise and could serve as mentors to participate. Thank you for that question.
We just received another one from Lisa Bain. Can you clarify when we should reach out to NICHQ and when we should reach out to NHSA? So we'll be getting into the TA request process in the coming slides, but just to clarify now, all requests will come through NICHQ and they'll be ushered out to the correct people from there.
Okay, so we are your TA center. So any TA need you have, start here. Thank you for that question, Lisa.
So Tess just chatted in the link to that needs assessment document. So it should be in this chat box for anyone who wants to access that now. From Kenneth Scarborough, do you know what percentage of the focus group responders were new to Healthy Start?
We do not. We could probably go through the attendance lists and take a quick scan to see if any of those names are recognizable and try to figure it out from there. But unlike the project director survey, in which we asked a very specific question about the grant cycles that grantees were involved in throughout the Healthy Start's history, we didn't ask that type of question at the beginning of the focus group. So we can definitely go back and look at our attendance sheets and see what we can figure out from that.
And I would just make a comment, because Ken and I participate in those focus groups. And we also, just from asking a few folks, there were fathers, coordinators that were new to Healthy Start doing the fatherhood work. And then there were also father coordinators who were new to Healthy Start, but not new to fatherhood work. And so I think that's going to be an important distinction too, and how well coordinators kind of execute at the local level. But again, having previous fatherhood experience coming to Healthy Start is great. And then as we saw in the report, the need for support probably around some of those folks who are brand new to fatherhood work and Healthy Start. So something to keep our eye on, Ken.
I believe that's all the questions we received just now. We're gonna have time for a Q&A at the end as well. So feel free to keep chatting any questions about the needs assessment. And we'll move on to the technical assistance activities.
Okay. So just wanted to highlight some of the activities that we've been doing. And although this is the official launching of the TA, we've been providing TA since we started, and so on a smaller scale. So we're really excited now to move into the bigger requests and want to encourage you to start, to go to the website and start making requests. But just to highlight a few of the activities that we've been doing with projects. And a lot of it has been via email. So folks, as they've reached out to the center, Tess in particular will receive that request, and we've been working with sites, individual sites, to execute and complete those requests we've gotten to date. And they've included phone consultations with some sites. There's been a connection made to some subject matter experts over COULD, and then an opportunity came to participate in staff meetings of a couple of Healthy Starts that we're able to join with the technology. And so we just want to put that out there as well, that there's opportunities to participate in your local staff meetings through technology, because that seemed to work well. And then we just have learned over the last few months that just having phone consultations is working well. So if anyone needs to talk through a request you may have, we're open for that. So just know that staff here at the center are accessible to you that way. So with that, fatherhood as it continued to emerge as a great need, as we knew. And you all see in the background, it's Kobe Bryant. And I think a lot of what we've heard last weekend has really been comments about his fatherhood. And those that have followed his career and follow basketball, you know that he really matured into becoming a father, and they have a little one as well. So just wanted to kind of pause for Kobe Bryant for sure and show a great picture of him with his daughter. She's a little bit younger. But what we've done under fatherhood, we did reintroduce and relaunch the Fatherhood Talk Tuesdays last November, which really began with looking specifically at the approaches and benchmarks that related to fatherhood. But we have an upcoming Fatherhood Talk Tuesday on February 11th. And later on today, you will actually receive an invitation to register for that webinar. And we'll be focusing on men and fathers' mental health. And so it really should be exciting. Also, at that time, we'll officially set the second Tuesdays from 3 to 4:30 for Fatherhood Talk Tuesdays. And we're working directly with the project officer, Dr. Brandon Wood, on those. And then also, we were able to provide support a regional training of the South Carolina grantees. And Ken Scarborough, my partner out there, was able to do that, I believe, on last week. And so we look forward to reviewing the results of that experience and then sharing as much as we can with others. And so we look forward to other opportunities of doing things like that. And as I said before, supporting staff meetings related to fatherhood, we've done a couple of those. And then the phone consultation. So again, when it comes to recruitment outreach, things that we've heard, sometimes those requests can be met through a phone consultation. So just keep in mind when you're making your requests, if you want to talk them through, we're open to doing that as well. Next, as you heard, breastfeeding really emerged, and we knew that. And we're really excited here at the center, and something we're working on prior to, because we've heard this need since day one. We worked on really being able to provide scholarships, CLC scholarships, certified lactation certification scholarships, and we're happy that we've awarded 45 of those scholarships, and I believe across 27 of the grantee sites. So a quarter of you or grantees are recipients of the scholarships, and we'll look for other opportunities of doing that. Again, responding to the needs that we've heard verbally as well as through this needs assessment. Also, we're planning an upcoming webinar with some breastfeeding experts from around the country and groups that you all are familiar with, Rose, Kathy Carruthers, and others, and really looking at some of the issues that have come up in the report, the myths about breastfeeding, challenges of breastfeeding beyond 6 months. And so again, really putting those experts together through a webinar, and then subsequently, we'll establish this breastfeeding group among you all to address some of the ongoing challenges to create that community. And we have an exciting opportunity to create community that Tess is going to talk about a little bit later with our collaboratory. So that's what's been happening with the breastfeeding. And then also we heard, again, it's very successful that grantees have established community action networks, which is really exciting to have almost everyone having a CAN in place. But what we'll look at is really individualized TA that'll be provided in partnership with the National Healthy Start Association, and then also looking at CAN partnership development. So again, talk about establishing MOUs and working with your partners. And we know that the CAN is going to be really important to support your fatherhood work, and having folks there that can provide some of the service to the dads that you enroll. Community engagement is a big topic under the CAN, and then just capacity building to address the social determinants of health and infant mortality and maternal mortality. So again, we'll provide that in an individualized way as well as bigger topics at other opportunities. With regards to evaluation, we've been hearing a lot from evaluators in addition to this report. But it really is important that we establish an evaluation group, and again, kind of centralize conversations, and so that your evaluators across the country will have an opportunity to share and learn from each other. And so we heard that loud and clear. And so that is definitely a direction we're working in with regards to responding to the TA needs that are out there. But having the evaluators come together, talking about the data and evaluation and so forth. So. And so we're not doing, I've also wanted to highlight, and many of you got notification that the original date of our grantees meeting was changed. And so we don't have a firm date just yet, but we are looking forward to an on-site, in-person, all grantee meeting in spring 2020. And most likely it will be in May. And so just keep your calendars open. We're working hard to get that date solidified. But again, this report will be used to kind of come up with those broad topics that make sense to provide when we're there in person. And if you have any thoughts, ideas of topics, for that grantees meeting, feel free to use the chat box even now before we get to the questions, just to catch your ideas there. And so we're not doing this work alone. As you've heard, we're working with the association. And so someone asked the question earlier, when you have a TA need, who do you go to? Well, definitely we're directing you to the TA Center, and any requests for fatherhood or CAN development, mentoring, or women's health, we've subcontracted with the association to provide and work with us on those TA requests. And so they'll start with us and we'll work in partnership with the association to fulfill those, but just to be clear. And so we're excited. Deborah is, again, they're not only providing specific TA, but the Healthy Start Association is a partner with us, and Deborah is also our chair of our faculty planning committee. And so all of the TA will be supported by a host of folks that includes our faculty planning committee members and many subject matter experts. And this is just a quick snapshot of some of those folks. And you may know, we've heard TA needs around FEMUR, around PPOR, some of the social determinants. And so here are some of the subject matter experts that will be working with us particularly, and then some of the organizations, individuals from those organizations that represent our faculty planning committee. And so just so you have an idea of these folks that are working nationally. And you'll see included in this snapshot project directors as well. So engaging every level, and certainly our project directors and projects in all of these requests is going to be important as we build this. Also, just to give you an idea of our training and TA structure, you'll see, and you have seen, offerings of monthly webinars on these topics. We will take advantage of in-person meetings. As I said, phone and email consultations. Again, we feel free to request a phone consultation, and we can work through some of your requests just to kind of clarify them. And then also, we'll do our mentoring program. So the peer mentoring program, again, is going to be important as we really start matching many of you sites up with one another to support each other. And then we're really excited to offer a COIN, the Collaborative Innovation Network. And so working with Peter Gore in particular. So we're excited to be providing our support through webinars and in-person and phone consultations.
Before we move on, just want to address one question in the chat box. The tentative location for the meeting is the DC area.
Okay. All right. So how do you submit a request? And so again, want to review for you that you go to the Healthy Start Epic Center website, and you'll see in the top right-hand corner a request TA link, and you'll click on that link and it'll take you right to the form to complete your request. You can submit requests across our 4 approaches, which again, you've heard earlier, but the 4 approaches of improving women's health, improving family health and wellness, promoting systems change, and assuring impact and effectiveness through ongoing Healthy Start workforce development, data collection, QI, and performance monitoring. So those are the 4 approaches, but we also want to emphasize that your requests also can come and if they're aligned with the benchmarks. And so any support you need around the benchmarks, your requests also can be around the benchmarks. So once your request gets here, it's going to be acknowledged within 2 business days by email from our Technical Assistance Center. There will be a follow-up phone call made to better understand your request if it's not clear. The center will work with you to understand your request in greater detail and then determine the best way to respond to it. And if appropriate, and we identify a subject matter expert, we'll connect you with that subject matter expert, and then you will develop a technical assistance work plan together, and we'll talk about a form that you'll use to do that. So what happens after you make this request to the Healthy Start Center? So we've created this flow chart for you so you'll kind of understand more explicitly what happens with the request from start to finish. And we'll be starting at the left side of this particular slide in the bright yellow. And so again, that opens the loop once you make your request to the center. And a few things could happen. The first thing that will happen, as I said, is the acknowledgement email to you. And also we will be calling the project officer assigned to the particular grantee site to talk about that request. The second thing that could happen is the TA center will respond to the request, and if the center can fulfill that request, we work directly with the grantee to complete a comprehensive assessment of that TA need, and then we will provide the technical assistance from the center. The third thing that can happen is once as we've spoken with you and gotten clarity on your request, a communication can be made with a subject matter expert as appropriate. And when we make that communication, the project officer will be on copy, so we will know that the TA has commenced with a subject matter expert. The subject matter expert, one of those wonderful folks from the slides before, will work directly with the grantee at this point. And so they will make a contact with you, and then you will work with them to complete, again, a comprehensive assessment of that technical assistance request, and we call that a CAT. And so the subject matter expert will work with you, the grantee, to complete the CAT. And then that CAT will be submitted here to the center for us to review it and to assure that the work plan, that the deliverables, everything makes sense. And then we will confirm the commencement of that plan and forward that CAT back to the grantee along with a copy to the project officer. And commencement of the TA happens, and then various points along that we will have touch point check-ins, and so the center will work with the SME grantee site just to see how things are going and if there are any needs that we might be able to help during that time. But the subject matter expert will notify the center when the technical assistance is complete, and they will submit a completed CAT to the center. So that form will come to us in its completion. We will verify and report, verify the report with the grantee to ensure that everything went well there. And then we will send out a formal verification report to the PO officer that this particular request has been completed, and that will close the loop. Now, up to the far right upper hand corner, there's also a fourth step that could happen. And we want you to note that if the request is determined that it needs a consultation with leadership, we'll speak with the MCHB leadership, and that could result in a webinar offering or training for some or all of the grantees. Again, sometimes the requests that you all have, many folks have the same need, and so sometimes we'll determine it could benefit a larger group. And so again, we'll consult with the Bureau on that, and then of course communicate with you as a resolution on how to address that particular TA. So that's the TA flow. You'll have a copy of this if you have any question on what happens once your request gets here, but that's the TA flow. And here is that comprehensive assessment of the technical assistance. And you'll see some of the information is repeated from your initial request, but we just go into a bit more details and are clear about outcomes and goals of the TA. And then again, creating that TA plan with the subject matter expert and creating a detailed timeline and tasks. And so key tasks, as well as completed by whom and the person you're working with. And so the deliverables be clearly articulated in this form so that everyone's on the same page and we know what the goal is and we can measure that at the end.
So now if anyone has questions about this TA process, please feel free to chat them into the box. We'll take a few minutes to answer these questions.
What's that Jeopardy music? Any questions at all about the technical assistance flow? Okay. So again, if something comes to mind while,
Okay, here we go. Ken Scarborough asked, must the request come from the project director only?
we want to verify with the project director that a request has been made, and I would hope that the workers are working with your project director to let them know that you're making a request. And so it doesn't have to, all requests don't have to come from the project director, but if a worker has worked with their project the project director, certainly they will make the request and notify that the project director is on board with the request. Because we certainly will follow up with the grantee as well as the project officer. So,
Mary Cronin asks, recognizing that TA requests are varied, what is the typical turnaround?
That's hard to answer since it's varied. But again, when the request comes in, there's an immediate response, and if need, a conversation to clarify what that request is, and the effort is put in to respond to it as quickly as possible. For example, we did receive a request for fatherhood consultation for a staff meeting that was happening maybe 2 or 3 weeks out, and we were able to set that up 2 weeks out just to be part of a staff meeting and had a presentation for that meeting. So that was an example of something being turned around. Some requests are to be pointed to different resources, whether it be trainings beyond the resource center. And so we work directly with sites to fulfill those as well.
Okay, it looks like we don't have any other questions for now. So if you think of anything, feel free to continue chatting into the box and we can address them later.
Yeah. And again, I encourage folks to really call the TA staff here. Technical assistant staff is really, I want you to know we're accessible. So again, if you want to talk through some of the requests, just to clarify, because sometimes folks don't know exactly what they need, but we certainly can start a conversation with here and work with you and your project officer to be clear about what the need of the request is. Okay, so thank you for your questions. So at this time, I'm excited to have Tess take us through the collaboratory. And again, we talked earlier, even from Becky's presentation of the needs assessment report, how helpful this information has been as we begin to think about establishing cohorts as we move forward. We certainly know that breastfeeding, fatherhood, evaluation are groups that we need to convene. But here's a great way that we can create a community to keep everyone connected. So Tess.
Okay, so we're really excited to introduce CoLab, which is a platform that was created here at NicheQ for quality improvement projects. We are going to be using CoLab as a space where Healthy Start staff from all over the country can connect with one another and share thoughts and experiences and discuss and share resources. In the main feed, you will see posts from the TA Center and your fellow Healthy Start project staff. You'll be able to post resources, ask questions, make comments, whatever you would like to share with your Healthy Start community. We will be developing groups based on certain focuses of all Healthy Start grantees. Specifically, we will begin with fatherhood, breastfeeding, and evaluation. For now, the community platform will utilize mention groups to reach out to certain groups of users. This means when you make a post, you can direct it towards a certain focus group, for instance, towards those doing fatherhood work. In the future, we will roll out a different group feature. This feature will allow the TA Center to create groups of resources, events, and conversations that are public, so everyone in the community has access, or private, so only specified members of a particular group have access. Public content will be included in the site-wide feed, whereas private content will only appear and be searchable from within its group. We will provide more information when this feature is ready for use. Next slide, please. All right, so after this webinar, we will be reaching out to project directors to request a roster of names of those staff who you would like to have a CoLab account. Any staff can join. However, we recommend including any staff who focus on fatherhood and breastfeeding work or evaluation. We will be creating accounts for project directors so that they can get familiar with the site. We encourage project directors to use CoLab to communicate with each other and have discussions between project directors around the country. Once we receive account requests, we will be creating the accounts for each user, and we will send along login information. Further instruction on how to navigate CoLab will be made available as well. We really are looking forward to communicating with you via CoLab and providing a space for you to communicate with one another.
Okay. So before I go into the next step for the center, I have a couple of questions, Tess, about CoLab that others might have. It sounds like, and correct me if I'm wrong, is this like a Facebook, if you will?
More or less, yeah. It's it will function as a place where everyone can post to one another. You can share resources. It does have that main feed, similar to how a Facebook feed is set up, and yeah, so it'll be a fun place for everyone to chat and get to know each other a little more.
Yeah, I know we've planned to also invite subject matter experts to be part of the CoLab as well. So again, as different issues, topics are coming up, we can have some feedback from some of the subject matter experts, and they can participate in some of those groups. So sounds exciting. So we're looking forward to that. Thank you. All right, so with regards to our next step for the center, we're going to continue to utilize this needs assessment report to continue to design our TA and CBA. As we mentioned earlier, not only are we using it as staff to come up with ideas and topics for webinars and in-person offerings, we again have shared this with our faculty planning committee. They will be using this report. Also, the subject matter experts will also receive it, and we're going to share it with subgroups. As we mentioned, the Father Talk Tuesday, looking at the highlights there. We have some project director highlights as well. If folks are interested in just seeing the highlighted document, we can make that available to you if you would like to use it locally in your Healthy Start, but really using this report to help design the TA and CBA that's needed. We're going to respond to the requests made through the Healthy Start Epic Center. So again, want to encourage you all, the gate is open now. So please make your requests, any requests, and we'll explore all that come through. So please utilize the form that's there on the website to make your requests. And again, we're in position to respond to it. Resources are in place to do that. We'll continue to work with the Father Talk Tuesday group and build that group up, and as a way for fatherhood coordinators to be connected on issues that are impacting men and fathers. And you might notice we're going to focus really on the preconception, prenatal, and postpartum, because a lot of the research is pointing us in that direction. So it's great to see these topics emerging in this report. So I think, again, the next Father Talk Tuesday focusing on men's mental health is really critical, as it's a real issue now. And then also working with the breastfeeding group based on a lot of this data. It's going to be a great place for those of you who want to be part of that group to kind of delve deeper into that needs assessment results. And then we'll be spending the next couple of months, obviously, getting ready for the All Grantees meeting in the spring. And we're really excited that the Bureau is working with the Healthy Start Association. And so in part, we'll be doing this meeting together. And so the grantees meeting will be occurring during the same time as the Healthy Start Spring Conference. So we're happy that we'll be working with Deborah Frazier and the association to also support their meeting. And so we look forward to exploring the dates and getting back to you as soon as we get a date for the grantees meeting. So that's kind of what we're up to over the next few months leading up to the grantees meeting. And like many of you, we also have reports that we have due to the federal government too. So we'll be working on our reporting as well. Okay. So again, are there any questions overall from today's presentation, going all the way back to the beginning, where you've heard some highlights from our needs assessment report? Any other questions come to mind? Anything on the how to request TA or anything about the collab that we can answer for you now? So
we have a few questions in the chat box already. Someone asked what the phone number for the TA center is, and you can address any questions to our email, which is healthystart@nichq.org. All of our staff members have different phone numbers, so if you want to reach one of us directly, please feel free to reach out to that email and we can get that number to you. We have a few people saying they didn't receive the needs assessment report, so just to clarify, it was sent along with the webinar announcement, today's webinar. It was sent on Friday, but it wasn't an attachment in the email, it was a link. So if you look back at that announcement, you should be able to access that link. But again, Tess chatted it into this chat box and she can do so again. And that email was sent out to our Healthy Start newsletter list. So all the project directors and everyone on that list should have received it. Jennifer Axtell asks if she'll have to contact us to create new accounts for every new employee that will use Collab. And as of now, we're going to request that project directors do send us that information for every employee. So that means for new employees, they'll have to contact us again. We're going to test out to see how that system goes, and for now.
And part of that is really to protect the Healthy Start community. And so if we manage it from here at this point, we have better chances of doing that. But as Olivia says, we'll see how it goes.
Lisa Matthews asks, the Collab group sounds similar to the project director's Google group. Will this replace the Google group?
We don't manage the Google group. That's managed by the Healthy Start Association. So it's not replacing the Google. It's not designed to replace it. It's a new offering, and I think the features here are a little bit different.
Chanel Reed asks, how do you access the Father Talk Tuesdays? So we'll be sending out the announcement for the upcoming one later today. That will come as an email, and it comes with a registration link for the Zoom for that webinar. So you would just register for the webinar and then click on that link the day of, and you'll be able to access the webinar. We also post the recording of that webinar onto the Epic site after, so you can always access it after the fact as well. Let's see.
Scrolling through the questions.
Yeah. Someone asked when the new screening tools are coming out. And that's really a question for the division at this point.
Yeah, so we definitely do not have an answer for you, but we also have an upcoming call with the division, and I'm sure that will be addressed during that call with our project officers. So thank you for the question.
Someone said the original grantee meeting was 1.5 days. Will that be the same? We travel a long way, so at least 2 days would be preferable. And all the logistics for that meeting are still being discussed, but we are looking at doing 2 days for this grantee meeting.
Yeah.
And just to clarify, the link that Tess is sending out to the needs assessment is the link for this webinar. But if you visit that page, the link to the needs assessment report is on that page.
And I did just send the direct link as well. So.
And I will just add, in addition to the grantees meeting, also just to keep in mind, the Healthy Start Association will be having its annual meeting as part of it. We're doing it jointly. So again, that would add more days for those sites that are looking forward to spending resources wisely. So keep that in mind as well.
Someone asked, should all of our staff join the collab?
Anyone from your staff who you think would get something out of joining the collab and communicating with other projects, absolutely. Like I said, we do recommend that people who work in fatherhood, breastfeeding, and evaluation specifically, we do recommend that they sign up for accounts because we will be having groups focused on those topics. But yeah, anybody from your project is welcome to join. It'll just be a great big community.
And as we build and identify the other cohorts, there may be opportunities, like we may end up with a CAN group, as an example, part of the collab, and where the CAN coordinator will be more, specific to that group. But again, it's open right now until we establish other groups.
Jeff Cool asks, while breastfeeding, fatherhood, transportation, and housing are paramount, where does maternal mental health land among priorities in the assessment?
Yes, I'm addressing.
As far as what themes emerged in the needs assessment itself, maternal mental health didn't emerge at the top as high as some of these other items. But that said, there's always an opportunity to raise this and continue to request TA or to request webinars and support around this topic, because we do agree that it is really critical. It just didn't, I don't know, it could be the questions that we asked. If you feel like there's a topic such as this that didn't really get revealed as you would hope through the needs assessment, we'd be happy to talk about that more and see if we can get some more information about it.
And for Jeff and others that may have that same kind of question, the TA Center is also working very closely with Dawn Levinson as well, and she's advising us on maternal mental health and behavioral health. And so working closely, again, identifying subject matter experts. I know that Wendy Davis is part of our faculty planning committee, who also specializes in that area. And the TA Center is also looking at other opportunities like wellness coaching, as an example, something we may be able to offer to sites as well to support mental health and behavioral health. So it's not highlighted in the report as Emily just described, but certainly it's on our list and something we're focusing on.
Just circling back to the screening tools, we have an answer from Vanessa Lee at the division. She just wanted to let everyone know that the division's still waiting for OMB clearance and approval of the new screening tools, which will be called data collection forms from now on. And they hope to have a date for the release of those tools by the February 25th Conversations with the Division webinar. So stay tuned for that.
Thank you, Vanessa.
We received a few more questions about the grantee meeting. We don't have dates yet for the meeting, but we'll inform everyone as soon as we do. And in terms of who will need to be at the meeting.
And those details will come as well. Yeah.
Are there any other questions we haven't addressed?
Okay. You have any other questions out there?
Yes, there is a Conversations with the Division webinar on February 25th, I believe. We'll double check that date right now. And the announcement for that went out yesterday.
Yes, it is on the 25th.
And if anyone's having trouble, if they're finding they're not receiving these emails, please feel free to email that healthystart@nichq.org email address.
Any other questions? Okay. Looks like we're good on questions. So if I just remind folks that this recording will be available on the Healthy Start website post call. So if you missed anything, you'll be able to access it a little bit later. So with that, we really want to thank each of you for being on the call today. As I said, it's great response. Almost 150 people on today's call. But thank you all again for participating in the Project Director Survey, and our thanks to the project officers who work closely with us as well and continue to support us. And it's important that we continue to build that relationship with our project officers. And our goal is to really make sure everyone stays connected and that we move this TA along with everyone kind of part of that journey. So thanks to those project officers, thanks to the division for its support, and thank each of you for the work you're doing in your respective area. And many of you know that I've been around for quite some time, but it's nice to be with the NICHQ team, as our team is really learning a lot about the sites and the difference in projects across the country. And I've been excited to see their enthusiasm as we've been going through this needs assessment report and the excitement they have. And so they certainly want me to remind you that we have lots of data from this assessment process that we can access. And so if you have any thoughts and ideas around any of the things that were shared today or the report itself, please let us know, and they're willing to do whatever they can to share more data, to look deeper into some areas if you'd like. So they really like doing that, which is exciting. So thank you to the DARE team here at NICHQ. And again, if you need to reach us, it's healthystart@nichq.org. So thank you, and you all have a great afternoon. And again, the recording will be available within a week of this call. So have a great rest of the week. Thank you so much for joining us today. This concludes our official launching of our TA. Take care.